might start with Senator Portman. You joined me on the floor today, Senator Portman, and I appreciate that. I know that you have a unique perspective because you served as the director of the Office of Management and Budget. Do you see this law increasing costs in your home state? Is it straining job creators like we're seeing in Nebraska?
To my colleague from Nebraska, I'm afraid the answer is yes. It is increasing costs and therefore making us less competitive. And when you increase the cost of doing business, of course, it impacts the economy. And you've laid this out very well, and I appreciate your comments this morning. You talk about the 800,000 jobs that are projected to be lost, and that's probably a conservative figure given the information that I'm getting from back home and that you just talked about. You talk about the fact that premiums are going to increase dramatically, 27–30%. Since you mentioned the Office of Management and Budget, I will also say this is about our businesses and their ability to create jobs and get this economy moving. It's about all of us as families and consumers having higher costs. It's also about our federal budget deficit. We have an expert on that in Dr. Coburn who will speak in a moment. But the point is that this is increasing costs to all of us in various ways. And the budget deficit is already at record levels, $15 trillion debt. Our country obviously is awash in red ink. And one of the reasons is, of course, higher health care costs. So this is impacting us in a lot of different ways. Let me address your question more directly, though, and that's in terms of the impact on businesses. And I will tell you, I've visited over 100 factories in Ohio in the last few years, and in every one I asked this question, you know, what's going on with taxes and regulations and energy and health care? And I have not been to a business yet that hasn't told me that their health care cost increases over the past couple of years have added to the uncertainty, the unpredictability, and therefore the lack of investment into jobs and growth. I went to a factory in Cleveland, Ohio one day, and this is a relatively small business that's actually seeing its sales increase a little bit. And the owner said, Rob, you know, I'd like to hire people, but I want to offer health care. Everybody here's got health care, which is great. And those costs embedded in adding a new employee are too high, they're prohibitive. So what I'm doing instead is I'm going overtime, I'm going part-time to avoid hiring a full-time worker. Luckily, I was there with some members of the media, and they were able to hear this directly from this individual who is making a decision about whether or not to hire somebody in Ohio during this weak recovery, and the health care law and the health care cost increases are directly impacting that. So it's for real. The U.S. Chamber of Commerce did a study recently, as you know. This was just a couple months ago. They asked small businesses, 500 employees or less, all around America, how does this impact you? 74% of them say the health care law makes it harder for their businesses to hire more employees. 52% of them say economic uncertainty is one of the top reasons they're not hiring. 36% say uncertainty about what Washington will do next is one of their two top reasons they're not hiring, and 30% say they're not hiring because of the requirements in the health care bill. So, I mean, this is not just anecdotal evidence we're picking up in our states as we go around and talk to employers. This is information that's out there for the public to see. I hope that all the activity that's surrounding this 2-year anniversary of the passage of this law from the Democrat side and from our side will rekindle this debate, because clearly we didn't get it right. We didn't affect the fundamental problem, which is the costs of health care rising to the point that it is affecting us as consumers, our families, is affecting our ability to get this economy moving, and is affecting our budget deficit in such dramatic ways. Doug Holtz-Eakin, who's the former head of the Congressional Budget Office, testified last year, and I thought it was really interesting what he said. As you know, the health care reform law says that if you're an employer with more than 50 employees, you've got to offer full-time employees with coverage, or you pay a $2,000 penalty per worker. And he made an interesting point, and I see this around Ohio with these small businesses that are maybe 30, 40 workers, and they're hoping to be able to add more. He said, and I think he's right, this creates a tremendous impediment to expansion. His example was, let's say the company doesn't offer health care benefits because they have under 50. They want to add another full-time employee. They take it up to 51 employees, $2,000 per worker penalty. After subtracting the first 30 workers, the fine to hire an additional worker would be $42,000 for that one worker to be added marginally to its workforce. So businesses have to offset that lost revenue, and the burden will be borne, as Doug Holtz-Eakin said, by who? The workers. Lower wages, fewer jobs, fewer hours to be worked, less job growth. There's one specific tax. You talked about the many taxes in this legislation, and the overall burden of the taxation on the economy is one of the problems with it. But there's also a very specific tax on medical device companies, and this is one that I know affects both of your states. It certainly affects Ohio. We've got a lot of very innovative medical device companies in Ohio. And they tell me that they are going to have to cut back on their workforce because of this new tax that's in the health care bill. So think about this. At a time when we're all proposing that we do more on science and technology, math and engineering, the STEM programs, we're trying to encourage more innovation in this country to be able to compete globally. Medical device business in Ohio and around our country has been strong. We're able to compete globally. We should be doing all we can do to encourage them and help them. Instead, we're doing just the opposite. There's a 2.3% medical device excise tax in this legislation, and it's going to hit next year. And they're already planning for it. And it's not a 2.3% tax on profits. That's what you would expect, right? It's a tax on revenues. So you could have a young startup entrepreneur who says, I'm starting this company, even though it's a lost leader the first couple of years, I'm not making any money, but I know that I've got a great idea here, and I'm going to continue to stretch this out to be able to create something of great value for our health care, for the quality of health care, to be able to save lives. And yet, I've got no profit, so I probably won't be taxed, right? Well, guess what? You are going to be taxed. You're going to be taxed on your revenue. Established companies that do have some profit, they're looking at big taxes on their revenues, particularly if they're doing well. And there are a couple companies in Ohio and around the country who have already told us what they're going to do. Let me give you an example. Last year, I visited Mound Laser and Phonetics Center outside of Dayton, Ohio. They provide services to the medical device industry, fabrication. They do very technical work. They have machinists there who are specializing in medical device manufacturing. They provide machining services to the device industry. CEO is a friend of mine, Dr. Larry Dosser, and he told me when I was there, he said, look, this could be devastating to our business, this 2.3% excise tax, because these are our customers. Well, unfortunately, he has just told me that he is going to have to start laying people off. January 1st, 2012, a couple months ago, they laid off people for the first time in their history. It's a 16-year-old company. It's an up-and-coming company. They've been adding people every year. Because of this medical device tax, they're having to plan for higher taxes, therefore a hit to their revenues, and they're starting to lay people off already. There are other examples. Meridian Diagnostics is in Cincinnati. And I've visited there, talked to the workers, talked to the management, and they tell me flat out, this is going to cost us, tens of millions of dollars, and this is going to result in us laying off workers. They're not sure if it's 40 workers or 80 workers. But it's, again, an up-and-coming company in our area that's doing the right things, creating jobs and opportunity and creating devices that'll help. In this case, by the way, also improve quality and lower costs of health care. That's what they specialize in. Diagnostic services, as you as a doctor understand, Dr. Coburn, can be incredibly helpful in getting health care costs down. And there are others. Stryker Corporation just announced its intention to lay off 5% of its workforce in anticipation of the implementation of this tax at the beginning of next year. So this is what's really happening. There's a better way. There's a way to reduce costs, to increase competition in health care, to make it more patient-centered. You all have been leaders in that. We have laid out alternatives. We're not saying the health care system was perfect before this legislation was drafted. Not at all. Of course it needs to be improved and reformed, and it can be. And it can be done in a way that both improves quality and improves the ability for people to have access in ways that, by adding transparency and adding competition and adding the value of quality and outcomes rather than just input and volume, to reduce costs in our system. We've got to do that. If we don't do that, this law will continue to affect our economy negatively. One reason we have the weakest recovery since the Great Depression is because of the impact of health care, and this law has made it worse, not better. So I thank you for letting me come by today to talk a little about this, and I look forward to the continuing dialogue.
Senator Portman, thank you. You make so many excellent points here.